In planning for optimal surgery and in planning to get a successful arthrodesis and reconstruction of the spine, there are many factors that come into play with regard to considering an optimal or an appropriate bone graft. And to that end, there are certainly patient factors, there are construct factors, and then there's the bone graft itself. With regard to patient factors, considerations including patient age, bone quality, prior surgery, perhaps prior radiation, the vascular content of the surgical bed. These are all really critical with regard to knowing how our bone graft is going to perform. Bone grafts for the interbody space are certainly different than they are in a posterolateral space with regard to what might be available or appropriate, and also with regard to handling properties and how the bone graft may be contained within a space. With regard to our constructs, there are different demands for different constructs, and certainly a posterolateral fusion that may involve fusion across a bone mass that's in some tension, or that's in relative kyphosis, can be more challenging than an interbody fusion. And the surface area certainly is a consideration. How well we prepare the surface area with our preoperative surgical techniques is important as well.